Hello, my name is Corliss Ivy. I'm a licensed clinical professional counselor at Cancer Treatment Centers of America. Today, I'm excited to discuss understanding and coping with stress. One of the biggest questions that we're tackling as a culture is, what is stress? Long gone are the days of believing that stress is something we think or merely feel. We're beginning to understand that it includes a physiological response in the body. It produces a massive systemic biochemical response, in fact. There was a time when we understood a stress response to be a chemical shift of upwards of 1,400 chemical responses within the body to maximize our chance of survival, meaning that there was a time when we were faced with a dangerous threat, our body would respond in kind to help us survive. We currently understand that additionally, a stress response can be produced with positive events as well as toxins in our environment, which could be food, some of the pesticides, enhancers, preservatives that we consume, skin products that we use, the water, and even the air that we breathe. I think we've all been behind that vehicle with the exhaust pipe shoveling smoke in our faces. Many of us are familiar with the sympathetic and the parasympathetic nervous system responses in our body: fight, flight, or freeze. In a stress response, our body begins to make many changes all at one time. Our pupils dilate, saliva flow decreases, our muscles may become more tense, trembling could occur, blood pressure increases as major vessels dilate, output of digestive enzymes in our stomach decreases, and food movement in our bowels slow down. And we'll talk more about that in just a moment. In my work here at the hospital, some of the symptoms that patients will describe are having headaches, muscle tension or pain, chest pain, low energy, fatigue, unexplained soreness in the mouth, and irritable bowel syndrome. From a behavioral standpoint, patients may describe an increase or decrease in their appetite, changes with their weight, troubles with sleep, specifically troubles getting to sleep or staying asleep for the recommended 8 hours, changes with sexual functioning, arousal, desire, even pain for both men and women, self-medicating, social withdrawal, restlessness, and even dynamic shifts in relationships. There are times when we may find ourselves a bit more connected or combative with people that we feel most connected with. On a cognitive level, patients describe difficulty concentrating, having confusion, memory loss, lack of motivation, or feeling overwhelmed. From an emotional standpoint, we often hear concerns related to fear, worry, irritability, guilt, anger, intense sadness, and hopelessness. We want to take a moment to pause and talk about the difference between acute and chronic stress. All of us are hardwired to support and manage stress that's brief and transitory. For example, preparing for a difficult conversation, even buying a home or graduating. Where it becomes an issue is when stress is prolonged and unmanaged. We refer to this as chronic stress. And this occurs when the body stays in a stress response to the extent that the autonomic nervous system is not able to activate relaxation regularly. Examples could include, especially in this setting, coping with an illness. Signs of chronic stress could include mental health problems such as mood and personality disorders like depression or anxiety, cardiovascular disease including heart disease, high blood pressure, abnormal heart rhythms, heart attacks, and stroke. Obesity and other eating disorders, reproductive or sexual concerns such as pain or loss of sexual desire in both men and women. Skin and hair problems such as acne and eczema, even hair loss, and especially gastrointestinal problems such as irritable bowel syndrome, GERD, and gastritis. These are concerns that we're beginning to see more in the mental health field. One of the things that I alluded to earlier related to bowel functioning and the way the stomach breaks down food is that when we're under intense stress, the body is less concerned with normal digestive functioning. So it's not uncommon for patients to come to us saying, I'm overwhelmed and I'm nauseous, I'm overwhelmed and I'm vomiting, or find myself running to the bathroom more often than I would like, all signs that we want to hone in on how someone's doing mentally and physically. And there is hope. There are many ways to take care of ourselves. This is the most exciting part of all. One of the number one ways that we can support ourselves is by connecting with a provider whose sole focus is to take care of us. For instance, working with a therapist. Dr. Nora Ishibashi reminds us that we hold the belief that we each can find deep satisfaction by taking the time to understand what is most meaningful to us and making our lives a harmonious expression of that meaning. The sole focus of this unique and powerful relationship is on working together to understand how we want our lives constructed, what obstacles prevent us from pursuing or achieving our ideals, and what needs to happen so that we can see our lives well lived. Additionally, there are several mind-body practices that run interference with the stress response and helps to engage the parasympathetic system. Engaging supportive relationships, it could be family, friends, coworkers, members from a faith or spiritual community. The question I would ask is, who are the people that you rely on for support? Additionally, meditation, prayer, mindful breathing, and guided imagery have gained a lot of interest and research over the past few years for their benefit. Guided imagery specifically because of the use of deep breathing as well as holding an image or intention in our mind to help train the brain toward relaxation when we need it most. Another fun modality is laughter. In addition to just being fun and helping us to feel lighthearted, it can shift our body biochemically from a stress response to a relaxation response. Additionally, it can help decrease depressive symptoms, increase our tolerance for pain, and even increase our ability to become more resilient when we experience stressors. There's a growing body of research that highlights the benefit of movement-based modalities. This could include yoga, qigong, tai chi, also fitness and dance. And we now know that based on our bio-individuality, there are styles that are most ideal for each of us. There's also benefit to biofeedback, which includes tools and resources that support the ability to measure relaxation. And certainly one of our favorites is the use of massage. When our muscles are tight and tense, as I mentioned earlier, and they're hovering around our ears, having a massage can loosen up any of the tension that may be a bit more difficult for us to manage on our own. Another way to take care of ourselves is to establish healthy boundaries, certainly around our time, but especially in our relationships, learning when to say no and taking time for ourselves whenever we need. Another important tool to utilize is creating relaxing rituals. Many of our patients discuss concerns with sleep. One of the best ways to create a ritual around sleep would include making sure that we're limiting electronics within the hour before going to bed, having an environment that's dark and not producing a lot of light, and limiting or minimizing stimulating foods or drinks just before we're going to bed. We want to adopt daily habits that support our mind-body wellness. Making time to eat food that is nourishing to our bodies, finding time for movement, and for the relationships that we discussed earlier. So as we round this discussion together, one of the best ways that we can walk away and begin to implement some of these practices is to take a self-inquiry, assess each area of our lives, and acknowledge our strengths and challenges, as well as our readiness for change. Important questions that you want to ask yourself: how am I taking care of myself? And how would I want to take care of myself? And lastly, we want to leave you with making self-care a priority and the ability to direct and manage our health and well-being in all aspects of our lives. Thank you for joining me on this fun discussion about stress and ways to increase your self-care. For more information, please visit cancercenter.com.